Hi there, can everyone hear me? Great, thank you so much for writing back. Welcome everyone to the webinar to kick off the 2018 DC Public Health Case Challenge. We're just going to give folks a few more minutes to join the webinar. So if you could just hang tight for a couple more minutes and then we'll get started. Hi there, everyone. We're going to get started now on the webinar. My name is Sophie Yang, and I want to thank you all for joining us today. Again, this is the webinar to kick off the 2018 DC Public Health Case Challenge. We're really excited for this year's event, and we hope you all are too. First, I want to let you know that, that we're going to switch up the order of the agenda a bit. So first, we're going to hear from Amy Geller, who's going to give a brief logistical overview of the case challenge. And that will be followed by a presentation from Alina Bachu, which will include Q&A. And then we'll have Liliana Zygo and Wyatt Benskin provide some remarks to close out the webinar. And just if you have any questions at any point, feel free to chime in during the Q&A portions, or you can write your questions to me in the chat function in Zoom. And if you have trouble finding that, you can shoot me an email and I can give you directions. So, so with that, I'm going to turn it over to Amy Geller.
As Sophie said, I'm going to first just give the logistical overview of the case challenge just to get that out of the way. So I'm going to basically run through the agenda and then let you know some important logistical items that would be good for you to know throughout the day of the event on October 14th. So we also will send an email just before the event with final, parking and how to get to the building and that kind of information, which is also in your student guide. So arrival and registration is between 8 to 8:30 a.m. Keep in mind that you need to turn in your presentation by 8:30. And so you can email that ahead of time to Sophie anytime. It could be over the weekend. It could be up until 8:29, or you can bring it on a USB drive to give to Sophie the day of in the auditorium. Even if you email your presentation, please go see Sophie in the auditorium because you'll need to randomly select the number for the order that your team will present. So we'll have 7 teams, and you'll randomly select from a box what number your team will be and the order in which you will present. Just so you know, we have a great judging panel lined up. We will share the judges and their bios 1 week from now. So we usually share that information about halfway through the time where you're working on your solutions. We'll then kick off the event with some, and I should add that there will be breakfast available in the Great Hall, which is right outside the auditorium. So that will be available to you. We then have Dr. Victor Zhao, who's the president of the National Academy of Medicine, who will kick off the event at 8:45 a.m. And then we will give some logistical information for you for the day of, and then we'll get right into the team presentations at 9 a.m. Please keep in mind that you cannot stay in the room in the auditorium until your team has presented. So if you're the first team, then you're very lucky. You get the opportunity to sit in the room to hear the other teams present. Unfortunately, if you're team number 7, that means that you do not get to hear the other teams present. But we've got something to help with that will happen later in the day that I'll get to in a moment. During that first hour of presentations, the staff will be helping you find your way as teams. We'll let you know the order the morning of to get your team photos taken in front of our Einstein statue by a professional photographer that we have on site that day. So it's a great opportunity to capture your team, and we'll be sharing those photos with you as well. We'll then have the first 3 teams present. We'll have a short break, and then the team 4 and 5 will present, followed by another break, and then team 6 and 7 will present. Keep in mind that you have, we'll go over that a little later. Sorry, there's so much information to share with all of you. Once all the teams present, the judges will break and go into a separate room to deliberate and identify the 4 winning teams. And as a reminder, the 4 prizes are the grand prize, which is best overall, the practicality prize, the multidisciplinary award, and then this year we have a wild card award, which is different for those of you who have participated in the past. And the wild card can be anything that judges would like. So it can be anything that stood out to them by a particular team. So it could be that they would like to present 2 practicality prizes, or it could be that they would like to present a prize on creativity, on presentation style, or anything that really stood out to them that was really excellent amongst one of the teams. While the judges are deliberating, you'll be getting lunch, which will be available in the tent. And then at 2 o'clock, we'll reconvene in the auditorium while the judges are still deliberating. And what we're asking the teams to do this year is to identify 1 team member who will give a 3-minute overview of the team's presentation in front of all the other competing teams. So for those who did not get to hear the other teams present, the idea here is for you all to get a sense of how the different teams approached it. It's also really good practice to figure out how to cram in, without speed talking, all the really key information about your presentation that is important for someone to know. So it's kind of like the elevator speech, which is that short, very pithy overview you might give at the beginning of your presentation, but with a few more details so that people can really get a good sense of what you're trying to do, how you approach your approach to solve the problem, and then what the key levers of your intervention were. And so that's something we'd ask you to identify someone from your team who will give that overview. After that, we will take a group photo. If the weather is nice, we'll probably go out to the Einstein statue again to take a photo of the entire group. We'll then head to the West Court, which we'll show you where that is, for the awards ceremony and a reception where the judges will join us. And so that's open to the judges, students and advisors. And it will also be an opportunity after the awards are presented for you to interact with the judges and staff as well. At the very end of the day, we'll ask the 4 winning teams to come meet with us, staff, myself, Sophie, and Alina, just briefly to go over the Future Leaders Luncheon the following day at the annual meeting. So the 4 winning teams are invited to join us at this luncheon, which also will include our emerging leaders here at the National Academies, which is a new program that we started a few years ago, and the fellows that we have. We have a number of fellowships at the academies, and they're sponsoring organizations. Dr. Zhao will kick off that luncheon as well. And then once we give a short overview of the fellowships and the case challenge, you team members will be each at a different table of the winning teams, and you will give that 3-minute overview that you worked on to the table, which again includes fellows, sponsors, and National Academy of Medicine members. And you will give the overview, and then the table will break out into a discussion about your solution, and they'll ask questions, and you all will have an opportunity to really talk very deeply about these issues that are affecting the DC area. So that's an exciting new format for us. In the past, we've had a team present, but we think that this interactive setup will be a great opportunity for sharing experiences and information and networking. So with that, a few other additional logistics. Wanted to point out that this year, so anyone who participated last year, we're using a different room. We're using the auditorium, which is a very large room with a lot of seating. And so the judges will be seated in the front row, and you will be presenting on the stage. And you can use just the podium if you would like, or we have handheld mics, and you can utilize the stage. That's simply up to your team. You can do it however you'd like. If you arrive to the case challenge early, you can check out the space and sort of plan out where you might be standing and get comfortable, with that space. There is, I believe, in your guide a link to a picture of what that space looks like. And if it's not in there, we will follow up with that. So in addition to the podium, like I said, there'll be 2 handheld mics. And then you'll also have 1 clicker that can be used to advance your slides. And again, you can have 1 person who's in charge of advancing the slides, or you can pass around the clicker as you take turns presenting. And then one other logistical piece, when your team is not presenting and you're waiting for your turn, or anytime that you're just not in the auditorium, the tent, which you'll be able to find it, it's very big, will be the holding space. That's where you'll hang out and be, and there's water in there, and I believe coffee throughout the day. So that's the place where you'll be able to sit and wait and talk to each other. And just one last reminder before I hand this over to Alina is that judges and the staff actually do not know what team you're representing. So please do not share that information until all the presentations are over. Please do not share that information with each other. Do not wear anything that would identify the school you're with. We want to, ensure that there's, no knowledge of that until after the judges are done deliberating. And actually, before we present the prizes, one of the things we'll do is ask those teams to stand up, identify themselves, and what areas of study they are currently undertaking. And with that, I'm going to pass it over to Alina. And then any questions you have on anything I just said, you can ask when we do that final Q&A portion at the end of the webinar. Thank you.
Hello?
Hi, Alina.
Oh, hey, I wasn't sure if you could hear me.
Yeah, we can hear you now. We do hear a bit of background noise. Sophie's just pulling up your presentation, and when she's ready to advance the slides, she'll let you know, and you can get started. I think she's actually just about ready right now. Sorry, everyone. We'll be starting in just a moment.
Just let me know when I should get started.
Hi, everyone. Sorry about that. I muted myself too and didn't realize. Can everyone see the slides?
I can
see.
Yeah.
Okay, great. So, Alina, we're going to hand it over to you now.
Okay, and I apologize for the background noise. I'm actually on Kingman Island with a whole bunch of little kids. But I'm just gonna make my remarks short, and then Amy can fill in any gaps and answer any questions when I'm done. And again, sorry about the background noise. So the purpose of the slides that we're sharing with you today is to help provide sort of a framing, especially for those of you who don't have a public health background, into the lens that it takes to reflect on issues related to preventing cancer and other non-communicable diseases that goes beyond the medical lens and a medical approach to addressing health issues. The main starting point for the conversation is first the definition of population health that was provided by Kindig and Stoddard in 2003, and this serves as sort of the central reference point for the Roundtable on Population Health Improvement, but it's also increasingly a way for the communities of the health sector, both healthcare delivery and public health, to talk about where things intersect in terms of the multiple factors that shape health outcomes, including cancer and other chronic diseases. In the slides, which unfortunately, because I don't have internet service for whatever reason on my phone, I wasn't even able to pull up. There are a couple of images that describe the social determinants of health. One of them is, I think, the Whitehead and Dahlgren one that was used in an IOM report back in 2003. But there are many similar figures that you'll see out in the field with concentric circles that show at the center individual level factors such as an individual's biology, genetics, heritability, and so on. But outside of that, the family and community factors, and in the outermost ring of that image is policy factors, such as housing policies, transportation policies, policies related to education, and so forth. Sophie, can you tell me what slides we're at like 4 or 5 or 6?
Sure, we're on slide 11 right now, and it's the determinants of health slide that you were just talking about.
So, and what comes after that? Sorry.
So next we have the social ecological model of health, which you kind of touched on already.
Briefly.
Should we keep moving forward?
Yeah, just keep moving forward. And so I'll just talk a little bit about why public policy is so important in thinking about these issues. For many people, including people in the health sector, when you're talking about health outcomes such as cancer, I think their thinking will immediately go to what can be done in the clinical sphere to address risk factors. So they will think about smoking behavior. They will think about, with regard to development of cancers in general, the level of physical activity, the food that's being consumed, and so forth. If we're thinking through this wider, broader social determinants of health lens, we are also thinking about what are the factors in which a young child is being born and being raised, what are the environmental stressors, what are exposures that may predispose that child to certain behaviors or to other risk factors that could contribute to the pathways that will take them toward that poor health outcome of cancer or other chronic diseases. And in terms of the policy level that can shape this, you can imagine that we're talking about not just policies that are related to health access and health financing, but we're also talking about policies related to education, because we know that fairly uniformly educational attainment is associated with low risk for a variety of poor health outcomes. People who are more educated are likely to live longer lives, are less likely to be smokers. If we're talking about the outcomes related to cancer, are less likely to have other kinds of lower rates of other kinds of conditions such as coronary heart disease and other negative outcomes. And in terms of policies that we might be considering with regard to a risk factor such as tobacco use. Hang on just a moment. Sorry about that. In terms of the level of policy for behaviors such as smoking, we would of course not simply be thinking about policies that relate to people's ability to purchase cigarettes, such as tobacco taxes, but we would also be thinking about bans on indoor smoking, which have been enacted pretty uniformly across the United States, and in many cases also bans on the use of tobacco products outdoors. There are campuses, certainly school campuses, but increasingly university campuses that are banning smoking outdoors. But we're also thinking about policies that govern the ability to advertise harmful products and advertise them to young people. In the case of tobacco, I think everybody is pretty familiar with the set of issues that we are discussing there. And one sort of emerging area of policy that if you're keeping abreast of regulatory developments at the FDA, you're probably aware that they're paying special attention to electronic nicotine delivery systems such as Juul and other e-cigarettes. And this is really relevant in part because there's emerging evidence such as that featured in a recent report from the National Academies that shows that for adults who are using traditional cigarettes, e-cigarettes could be a way to perhaps reduce harm because electronic cigarettes are not leading to combustion of tobacco, but rather just vaporizing a nicotine containing liquid. But there's evidence that is beginning to point in the direction that for teenagers, exposure to electronic cigarettes may actually be exposing them to increased vulnerability of developing actual dependence on tobacco and tobacco products as they get older. Sophie, are there additional slides that could sort of help remind me of where else I'm supposed to go after this?
So, Alina, did you want to sort of talk a little bit about the interpersonal, well, I guess you talked about that already, the different levels at which, and how those interact with big P and little p policies.
Yeah, so obviously, I touched on this a little bit earlier, the pathways that lead us to poor health outcomes in terms of non-communicable diseases, including cancer outcomes, are operating along multiple interconnected pathways that operate at various levels. And in terms of policy, we're talking about very high level national policy, such as those that will shape people's incomes. As I mentioned earlier, people who are more educated are less likely to smoke or engage in other risky behaviors, but we know the same thing is true of people who are wealthier. Poverty is often associated with poor decisions regarding health, and we know that that is due to all kinds of research, all kinds of factors that have been illuminated by research in recent years that demonstrate that people who are of lower income and have poor education are exposed to much higher level of stress for a variety of reasons. They have less fair access to a variety of life chances, including housing, including income security, food security, and so forth. And as you're all aware, or maybe many of you are aware of the concept of ACEs, adverse childhood events. These are increasingly understood to shape life chances, and children who are being born in situations where their interpersonal relationships are being strained by domestic violence or various kinds of child abuse, or where there's a parent who is incarcerated. All of those factors are contributing to the buildup of a toxic level of stress in children. And, to put it in the simplest way possible, we know that people turn to products such as cigarettes when they are experiencing a great deal of stress. And it's just a very simple way to think about why people who come from more vulnerable backgrounds are more likely to consume tobacco products, because it may be a behavior that is helping them, or appears to be helping them cope with the stressors that they're experiencing in life. And there is a wide range of policies that could be helping to create environments that make it harder to make those negative decisions. And I touched on some of those earlier. Was there anything else that would be helpful to go into, Amy? I'm so sorry I don't have the slides with me, and I don't have the usual visual cues I could rely on to sort of lead me along.
Yeah, this is a good example of life being life, and this is how it happens, right? So, well, I think the only other, major part of what you were going to talk about was just how, where we are in terms of spending on healthcare and social spending and compared to other countries, and just that conflation of thinking of health as healthcare, but it's not.
that's right. Yeah.
But other than that, I think you covered it all. So
yeah, that's a good reminder. I could say just a few words about that. This was actually extensively addressed in a report that Amy and I worked on back in 2012. It's called "For the Public's Health: Investing in a Healthier Future." And it referenced research by Elizabeth Bradley and colleagues. She was then at Yale. She's now the president of Vassar. But Lizzie Bradley is really one of the main people who has looked at OECD data comparing U.S. spending on healthcare services as part of social spending overall, and found, not surprisingly, that the United States puts most of its social spending eggs in the healthcare basket, and we invest much less in other kinds of social supports. And this appears to be an explanation of why, despite our enormous level of spending on healthcare, which I think now is approximately $10,000 per capita in the United States per year, we are getting at best mediocre results. And this is important because we already know that we have been concerned for some time about the spending curve on healthcare, and the fact that as our GDP, the proportion of the GDP that's going to healthcare approaches 20%, we will be less able to spend on other kinds of things, such as education. There is further data that's been highlighted by people such as Peter Orszag that has demonstrated in very, very understandable practical terms that when a state is investing in Medicaid services for its residents, although providing Medicaid to more and more people is a really valuable undertaking, we can see very clearly that it takes away from the funding that is available for higher education. So there's going to be less money for the state university system if more money is going to healthcare. So on the one hand, we want to see Medicaid expansion, and we want to see people have access to healthcare. That is one of the essential public health services, and we all believe that that's a human right. But we would like to see more investment in the upstream factors that we know support improved health outcomes, and education is one of them. And there's I don't remember if we're able to share the slides with you. I think maybe we are, or at least the references related to the slides. But that'll give you a starting point if you're not familiar with Elizabeth Bradley's research, and some of her more recent work has actually compared states in terms of their healthcare and social spending overall. So I think that's about it. Anything else that I should touch on, Amy, or I mean you could deal with any questions.
Yeah, I think you covered it all, and we can. I think we will probably post the slides again, probably, and we'll probably email them out after this call as well, so folks have them if that's okay with you.
Sure thing.
And then,
and I should just very quickly say that we owe a debt of gratitude to Paula Lantz, who developed most of the slides to be used for a previous webinar that she gave. And Paula is a member of the Roundtable on Population Health Improvement, and has just been a terrific resource to us in helping us make it clear to the teams that don't necessarily have a ton of public health backgrounds that it's always helpful to look upstream and not simply limit yourselves to thinking about what could be done in the clinical care setting, even in terms of clinical primary care.
Great. I think up to questions for Alina specifically regarding the presentation that she gave. So regarding, the view of population health, the social determinants of health, looking at primary and secondary prevention, thinking through this through the ecological model. Any questions around that? So you can either raise your hand, and Sophie can unmute you, or raise your hand virtually, I should say, on Zoom, or you can type a question into the chat box. So we'll just wait a minute or two to see if anyone has any questions. And if not, we'll move on to the next piece of the webinar.
Amy, this is Sophie. I haven't received any chat messages, but I'll wait a little bit in case someone's still typing.
Yeah, I think we can wait one more minute. And if not, during the next set of Q&A, if you have any questions regarding that, even Alina, if you can't stay on, Sophie and I would be able to respond to those questions too. Well, Sophie, why don't we hand it over to you to bring us into the next session and part of the webinar, I should say. And then if you have any questions that you didn't have time to type in, or you think of as we go through, feel free to send them along.
Okay, great. So I think now we are going to hear from Lily, who competed in the case challenge in the past, and she is just going to give a few minutes of remarks and tips from the perspective of a past case challenge participant. Lily, I'm going to hand it over to you now.
Perfect. Hoping that everyone can hear me. So I participated in 2016, and just reflecting on that experience in terms of the solution or intervention that your team comes up with, it's really important to ground your intervention in evidence for the solution and clearly articulate how the population that your solution focuses on and why you chose that. We found it really helpful to go to other parts of the country or look at other successful public health interventions to really ground our case in research. So I know that it was mentioned before about the stage, and so our team specifically decided that we would have one person click through the slides because of such the limited amount of time that you have. It made more sense because our presentation we'd practiced so many times. One person clicking the slide saved us time from having to pass that back and forth. We decided to have one person at the podium and then a couple people standing around also to capitalize on as much time as we could. So we practiced our presentation a lot of times. We got to present in front of our faculty advisor, and she was really helpful on anticipating that the questions the judges might ask. Our team had, I think, over 26 appendices, and so some of the questions that we anticipated, we intentionally would leave out of the presentation, both as a way to save time, but also when the judges asked us a question that we anticipated, we were able to jump to the appendice of that question. And I think it was really helpful that to show the judges that we had thought about some of the barriers and we could anticipate the questions that they would have. I think another really important point is during the day, not just to not have your school logo or anything, but also to not say anything that would give away what school you're a part of. It was hard not to have that school pride, but it is really important to not give away what school you're from. So I definitely say dress formally, but also dress comfortably. So yeah, that is my short spiel on advice.
Great, thank you so much, Lily. Does anyone have any questions for Lily? And you can ask them later too if you think of them later.
Maybe Sophie, maybe while they're thinking of their questions, I could add in the few other sort of tips for the team.
Sure.
Yes. Together. Sorry, I didn't mean to interrupt you.
No, absolutely. Go ahead.
It's always so hard virtually. So thank you so much, Lily. It's always really helpful hearing from a past participant and someone who's been in it. So those of you on the phone, I really encourage you while I'm giving you some other, tips to think if you have any questions for Lily and take this opportunity to ask her any questions. And I'd like to point out that Lily this year is also a member of the case writing team that Wyatt will be presenting to you briefly what the case is this year. So I wanted to thank Lily and Wyatt for their hard work on that this year. So Lily mentioned really grounding your presentation in evidence, and to build on that a little bit more, really think about what are the assumptions you're making going into your presentation. That will really help you ground it as well. And how might the circumstances of the population for which you're targeting your intervention differ from those who maybe if you're basing this on something that exists and you're changing it or basing this on certain research outcomes, what is different from this population from that one, and how are you going to address those uncertainties? And then, are there any local or existing programs that you can build off of to really leverage, the funds that the fictitious funds that you're being given in this case? So one other thing we always encourage the teams to do is to engage with the community that you're aiming your solution towards. Go talk to people who understand the perspective of those who might participate in the intervention. This really helps you get at cultural sensitivity, practicality, all those types of things. And if you do that, be sure to let the judges know, and include that in your presentation that you did reach out to these and the things that you learned, even if you don't go into it in depth. I think that's a really important thing to share that you have done. And part of your solution might even be how you plan to engage folks moving forward to ensure that your solution really is keeping its relevance moving forward. And then just when you're presenting your solution, I said this earlier, be sure to have that very brief quote elevator speech. If you only had 30 seconds worth of someone's time, what are those key things that you're going to cover and that you would want to talk about? And we're also actually going to send you a lot of these best practices after when Sophie sends you the case as well. So you'll be able to get some additional in-depth feedback from just, these are best practices and things that we've compiled over the years, over the last 5 years of the case challenge, of things that we've seen where improvements could be made in the presentations. And so we just want you all to be able to grow off of what we've seen and learned over the years. And then anything that you can do to help the judge visualize your solution in action, whether those be graphics or narratives or stories or anything like that, is always helpful, and those always stick in the mind a little bit more as well. And I would like to add or second what Lily said in terms of anticipating what the judges might ask and some of the barriers, so that you're prepared with that. And then just in your presentation and delivery, don't rush through your presentation. You want to figure out what are those most important parts to present and, really flesh those out. And then you can, like Lily said, have appendices. We print copies of all the slides, including the appendices for the judges to have on hand during their deliberation. And when you have some really important key statements, and this is about presentation style, but sometimes it's really impactful to just wait a moment. I know you don't have a lot of moments, a lot of time, but to just wait a moment and really let what you say sink in with the judges, even if it's just a few seconds, for those few, key things that you really want them to hear that you think are really important, or a really important piece of evidence. And then finally, I think it's really important to stand behind your case solution. When you respond to the judges, don't apologize. If they don't necessarily agree or something like that, do give them more information and understanding of why you went in a certain way, but don't lead with apologies. Be confident in your solution and really stand behind it. But do, of course, acknowledge the important feedback that the judges are giving. And I think I'll end there. Like I said, we're going to email you. It's just about 2 pages of a few best practices. It includes what I just offered and what Lily offered, and some additional things as well. So now I guess if you have any other questions for Lily or myself, we'll be happy to answer them. And just while you're thinking, I would add that, if you have any questions throughout the case challenge process, Sophie is going to include in her email to you with the case information on how to get in touch with us. We're here for you over the next 2 weeks. I think there is one day that all of us are in a meeting, so the response time would be slower, and Sophie's going to let you know that. But other than that, if you have any questions, let us know, and we will respond, actually share the question and respond to everyone so that all the teams are, have that information. Okay, well, Sophie, did you get any questions in chat?
Hi, sorry, I forgot to unmute myself. There are no questions in the chat right now that I see. So maybe we can turn to Wyatt now. Oh, I'm sorry. I just received a chat or a message in the chat. And the question is for Lily. And the question is there anything you would have changed about your presentation?
I definitely think I would have spent less time trying to explain public health to the judges because they are all professionals. And so our team did spend quite a bit of time of explaining sort of our philosophy behind our intervention. And I wish we had spent more time on the intervention itself. Definitely give that background and your evidence and research, but sort of skip the like, but what is public health and why will this be helpful?
That's a really good point. You should go in with the assumption that you know, the judges have read the same background information as you, meaning the case that we're going to send. We do share that with them, so they will have those facts. Now, if there's really important facts that you're really using to inform your approach, you know, you would make sure you want to raise those, but you can also assume that they do have that basic level of knowledge. Thank you, Lily. That's a really good point, and actually something we can add to our best practices for the future. Thank you.
It doesn't look like there are any other questions right now. So I think we'll let Wyatt give his remarks right now. Wyatt, are you there?
I am. Can you hear me?
Yes, great. Thanks, Wyatt.
Perfect. So hi, everyone. As Sophie said earlier, and again now, my name is Wyatt Vinskin. I was the lead writer for this year, the case, last year, the case, and then I was just a writer in 2016, and Lily was a writer this year as well. So before I have the great honor of announcing the case, I want to say that you know, it was real fun working on it. It's always a challenging problem, and it's great. So it's written by a team of students, if you're unfamiliar. So we all came from different DC area universities and have backgrounds, varied backgrounds, undergraduate, master's students. And so we all work together in conjunction with the NIM staff in writing the case. So we actually, the students, the writing team, we developed the specific kind of ask and the specific topic under the broad umbrella, which you already know. So, and it was, like I said, it was a lot of fun. And one thing I definitely also want to make a point of now, while I think I have everyone's attention before I say it, is, you know, there's a lot of information in the case. If you've looked at cases previously, if you've participated before, it's the length of the document is right in line with previous years. So it's a lot of information and it's a lot to process in a short amount of time. We intentionally do that. There is maybe more than you need in there, but we're not trying to trick or mislead anybody. You know, mistakes happen. We've put this through a lot of different peer reviews and proofreads, but mistakes happen, or, you know, things may not be, you know, were clear to us because we were in the depths of it, but they may not be clear to you. So I would just encourage you, don't hesitate to email Sophie. I think her email's in the document, and details on how to do that with questions. And like Amy said, that'll go back out to everybody. It's a lot of information to process, and we know that and we recognize that. So don't hesitate to ask clarifying questions during these next 2 weeks. So with that, I will introduce the case. I'll give you the title of it, and then I'll talk a little bit about why we picked it and why we think it's important. So it shouldn't be a big surprise now because we've talked about the issue on the webinar, but the case this year is reducing disparities in cancer and chronic disease, preventing tobacco use in African American adolescents. So very in line with what Alina was talking about, not so coincidentally, you know, but the issue is definitely one of the most relevant, I think, the cases have ever been. As we were polishing it up the last couple of weeks, it seems that every day there is something new coming out about tobacco use or e-cigarettes, specifically the relationship between those in certain communities. And so this case is really trying to tackle the issues of cancer and chronic disease, which is very much a life course issue. And that's highlighted through the case scenarios. We present kind of stories of people. So, you know, there are huge disparities in lung cancer rates and death. And there's also large differences in tobacco use, you know, e-cigarette use, tobacco in forms of both cigarettes, but cigars, little cigars, all of that. And these disparities often fall along socioeconomic and racial lines. So this year in the case in particular, we really wanted to focus on Ward 7 and 8 in DC. So we are really narrowing it in for you all to create a solution that really is targeted towards a very specific community. So there's a lot of diversity within those communities, but it's a very specific community. So the case covers everything you should need to know about, lung cancer and other associated chronic diseases with tobacco use. And really, we want to think about this as a life course issue. Lung cancer screening and diagnosis, and unfortunately death all come much later in life, but the number of cases that are attributed to tobacco use and how that tobacco use begins at such a young age is evidently clear. And the last thing I want to say before, hand it back to Sophie and Amy and take any questions you all have is, we highlighted, particularly this year, which we've done in the past, but really emphasizing this year that we're looking for novel and creative solutions. In the field of cancer disparities and tobacco use, there's been a lot of work previously, and we've touched on that in the case. And this is kind of the chance to be creative, to think critically about this problem from a new angle, and to step outside these classic boundaries, or these classic interventions that have been developed. So, we're not, I'm not a judge. I should also say that. This is my own personal opinion, but I think that, we don't really want solutions that are just taking another intervention and applying it to this community. We want something creative that will work for this community in DC and the specific issues that this community is facing. So I think it's a great case. I hope you have fun working on it. I don't live in DC anymore. I just moved, but I'm coming back, so I'm excited to see all of your presentations on Sunday. It was a great fun last year. Really creative what teams came up with. And I'm happy to take any questions you have now. I know I was very brief in kind of what the ask is, but that's all very, very well laid out. But kind of get the wheels turning on what you'll be looking at. So with that, I'll hand it back to Sophie and happily take any questions.
And this is Amy. While we're waiting to see if you have any questions, and I don't want to speak for you and the team, Wyatt, but I think that one of the facts that's in the case that really struck the case writing team and had them go down this path for the case and the topic was that in DC, African Americans are, and tell me if I get this right, Wyatt, twice as likely to be diagnosed with lung cancer and twice as likely than any other racial or ethnic group to die from lung cancer. And I think I got that right. And so that fact, I think, was really striking to them, because we are talking about advancing health equity here for this case. And so I think that's really what ended up leading them down this path of preventing, tobacco use or looking at this from a life course perspective and seeing how to really move the needle on that incredibly large disparity in DC.
Yeah, absolutely. You definitely got those stats right, and they're right there in the case, and you'll all see those. And there's even more in there that'll stand out, and some details on, tobacco use by GPA, even from a youth study that was done in DC. And certainly one other thing, just thinking about where, how we as the team kind of arrived at this interest also is that there's so many points of intervention, and this is something that Amina mentioned, and that I want to underscore again is that. The case is long, but frankly, it could be twice as long if we actually thought about every single area in that socio-ecological model or in the population health model. So thinking again about all those different points of potential intervention, and are there interventions that can cross points? And I think that's what made it so fascinating for us. Is there are huge racial disparities, and quality of life and loss of life. Disparities in outcomes, and also so many opportunities for creative and thoughtful and appropriate interventions.
So we'll wait a few more minutes to see if you all have any questions. But in the meantime, I just want to let you know that after this call, or as soon as she can, after she closes out the Zoom, Sophie will be sending you the case that Wyatt and Lily and team worked so hard on. And that will have, again, more detail. And, this isn't your only opportunity to ask questions. As both Wyatt and I said, you have opportunities over the next 2 weeks. So we only have 3 minutes left on the webinar, so we might as well wait another minute to let you think. If you have any questions on anything that we talked about throughout the webinar, so, again, anything from logistics that I gave in the beginning to lessons learned from Lily to more details about the case from Wyatt. And like I said, this will be posted, so your teammates who weren't able to join can listen in. And I'd like to apologize again for some of the technology issues and connectivity issues on Alina's side. But I hope that this was helpful to all of you.
This is Sophie, and I haven't received any questions in the chat. So it doesn't look like there are any questions.
Okay. That just means everyone did a wonderful job covering all the details.
Okay, great.
Good. Okay. Well, I think with that, Sophie, thank you so much for organizing this and getting us organized for the day. And thank you in advance for getting the case out. And thank you all for participating. And you'll be hearing from us very soon. And good luck. And we're really looking forward to hearing your solutions in just a little over 2 weeks.
Thank you, everyone.
Take care.